The demand for COVID-19 testing remains high tonight. People are waiting hours at testing sites across Metro Detroit.
Officials worry this will only get worse. 7 Action News reporter Kim Russell spoke with Michigan's chief medical director about what we could see in the coming weeks.
It's something we heard about a lot at the beginning of the pandemic, how we can all work together to flatten the curve. Michigan's top medical executive, Dr. Natasha Bagdasarian, says we need to be talking about flattening the curve again. Take a look at this graph from the Michigan COVID response data and modeling update just released this week. It shows average hospital admissions are increasing for all age groups, up 20% since the previous week. Among pediatric patients, the number has almost doubled.
We're currently seeing hospitals not only struggling, but we're seeing increases in our overall mortality. So that means that overall access to medical care is likely being delayed. And that could mean worse outcomes for people around the state, whether or not they have COVID-19.
The state's chief medical executive, Dr. Natasha Bagdasarian, spoke yesterday to 7 Action News about how in some states they saw a 1,000% increase in case rates. Today, she wanted to clarify. She says as experts forecast with different models, the models do not necessarily indicate that will happen here.
So looking at what's happening at states around us gives us the best idea of what could happen here in Michigan. We are in a different place, though, than some of the states that have been hit hardest. Many of those states were not experiencing an ongoing Delta surge the way that we were just very recently.
Dr. Bagdasarian is making a plea to individuals, businesses, communities, and schools.
If the majority of the public right now sees that there's something really quite scary coming, and they decide that this is a good time to get vaccinated, a good time to get boosted, to upgrade their masks, to wear masks in public settings, to send their children to school in masks, if all of those things happen, then we could end up without a devastating surge that we are now preparing for.
Now, to refresh your memory about the meaning of flattening the curve, it's about keeping the number of cases in our hospitals below hospital capacity so that hospitals don't have to make tragic life and death decisions. Kim Russell, 7 Action News.